everybody. How are we doing tonight? Yay! Thank you for all coming. This is really exciting. This is our second annual Cannabis Symposium at the Lyons Farmette, which is just an amazingly beautiful place, is it not? Thank you, Betsy, for making this place available. This is our second annual Cannabis Symposium, and I want to thank Mandy King, my coordinator, who put this event together. She worked very hard. She's a very smart girl and a very talented girl, and brought this all together tonight for all of us to come and converse. First of all, I get a little bit nervous in public speaking. You wouldn't think that as the publisher of a magazine, but I would much rather be behind the camera than in front of it. And I was just telling him, watch the angles. One of the things that I wanted to talk about was why this event is in place and why we're videoing it. I'm very proud to be hosting the event at this place, but the idea stemmed from observing the conversations in the community around cannabis, in my own community and elsewhere, and so many of the stigmas that still hold true in many people's minds, and a lot of the miseducation, or that's the correct word, but a lot of the inaccurate information that people believe about cannabis. And I realized as a member of media, I've been in it my whole life, and I have a very devout belief that we have a responsibility. I'm an independent publication. We've been around 17 years, and I would rather quit the business than compromise what I believe is absolutely true for us to be doing, which is journalism standards. The Great Wall of China exists between advertising and editorial at Yellow Scene, and I'd rather be done if we have to compromise that to be in business. So we stay mighty but small and independent. There are probably more glamorous and better ways to make money than being in the independent media, but I really love what I do, and I've been doing it my whole life. One of the things I realize, and I've had the great opportunity in my career to be influenced by some really brilliant journalists, and they really shaped my views as a publisher, that media has power. We have influence. Words are important, and conversations are really, really important. And when we have inaccurate conversations or incorrect conversations with wrong information, a lot of negative things occur. And so it's our responsibility as members of media to host conversations. That's our job, is to start the conversation and hopefully tell the truth in the process. So I wanted to have an event that was not a celebration of the legalization of cannabis, not a smoke out, but where we as a community came together and discussed this very legitimate industry and its ability to change not just our recreation, but hemp, medicinal, all of the products that can be used from hemp, and to have that conversation so that we can move forward with the legitimization that the industry deserves. So that's the purpose of the event. I have my notes here. The thing I believe is that, I already said all that. I didn't even need my notes. So with that, the goal was to bring different people together in the community. Last year was about the legitimization of the industry. I think there's progress that needs to be made from within the industry as well as outside of the industry. I think that the industry itself can do things that help further that. This year it's about regulation. And an issue that's very close to my heart is the judicial system. It's a piece of our culture that I'm very actively involved in, and I believe deeply in reform. So the regulations are critical for the legalization of it, but it's also their impacts on people's lives. And so we brought together much, much, much smarter people than me to be able to talk about those things, because the regulations are a bit complex. Who we have coming in is Mary Brosy, and I'm going to say your last name wrong. Wiwchar? Mary? Okay, sorry. Deputy Director to Jared Polis. Hang on just a minute. Jonathan Singer, our state representative. Richard Collins, a CU law professor who teaches a course on cannabis law. And we have Teri Robnett of the Cannabis Patients Alliance, who is a regular advocate. I also want to thank our sponsors, Green Dream, Colorado Normal, and NoCo Hemp and Expo, which are going to be hosting quite a few events through the year. And with that, I'm going to bring Mary up. And at the end of the event, we will have a Q&A. All right, enjoy your dinners. Thank you.
Good evening, everybody. Thank you first and foremost so much for having me here. I'm excited to have received the invitation. I know that I'm a sorry replacement for Congressman Polis, but I promise I'll do my best. Thank you. Sorry, you distracted me. Come on, Lizzie. My name is Brosy-Wiwchar, and I've had the pleasure of being Congressman Polis's district director. In this position, I've had a really unique and different view on cannabis legislation and the movement from a federal level. When I first started working on cannabis issues back in 2013, members of Congress and their staff treated cannabis and the cannabis economy as a joke. They brushed off cannabis and the people working hard to legalize cannabis as a bunch of hippies, people just looking to get high. What they didn't realize is that the cannabis economy is full of diverse, hardworking individuals, small business owners and tech startups, doctors and patients, farmers and botanists, men and women, people from all walks of life working hard for this industry to move forward and to be legitimized. States like Colorado and now dozens of other states have proven that allowing responsible adults to legalize, purchase marijuana gives money to our classrooms, not cartels, creates jobs, not addicts, and boosts our economy, not our prison population. In 2016, taxpayers in Colorado gained more than $200 million in tax revenue from the sale of regulated marijuana, and over 23,000 jobs have been created since implementation. Give yourselves a round of applause. Now that the majority of Americans reside in a part of the country that has legalized medicinal or recreational cannabis, I hope lawmakers will realize it is time for Congress to act and pass federal cannabis legislation. There are a bunch of important pieces of legislation that have been introduced this Congress, with more and more members realizing that federal prohibition is not the right path. All of these issues that were discussed should be enough at the very least to convince you, that prohibition does not work. Representative Polis just reintroduced the Regulate Marijuana Like Alcohol Act, as well as the Industrial Hemp Farming Act, and is constantly urging his colleagues in Congress to immediately pass both of these bills to protect states' liberties and allow for the industry to continue to grow. Nearly 7 months ago, Rep. Polis launched the Bipartisan Cannabis Caucus, along with Representatives Earl Blumenauer, Representative Dana Rohrabacher, and Representative Don Young. This caucus is going to be the next step in moving Congress into the 21st century on drug policy issues. The caucus will serve as an important working group to discuss marijuana policy and its future. This will take education, which is the primary goal of the Cannabis Caucus. Education that will make sure marijuana businesses get the same basic tax deductions to help them get off the ground that every other business gets, as Representative Earl Blumenauer is working to do. Education to make sure that states' rights on drug policy take precedent over federal policy, as Representative Dana Rohrabacher is working to do. Education that will make sure that having marijuana will not take away your right to own a firearm, as Representative Don Young is working to do. Education means finding a person to lead the DEA who will set enforcement priorities that work in cooperation with, not in opposition to, the will of states' voters. A person who will embrace science and fairness over unfounded fear and antiquated dogma. And it means finally ending federal prohibition on marijuana, getting rid of the antiquated CSA provisions that equate it with dangerous drugs like heroin, and enacting a regulatory structure that we all know can work. Other policy changes that should occur and are more important than rescheduling are endless, but here are only a few. The NIDA monopoly, allowing NIDA to cultivate marijuana for research purposes, is not required by law, but is detrimental to our communities. With the ability to easily conduct research, researchers will be hindered in their efforts to develop and manufacture new drugs. Virginia currently has a policy prohibiting clinical staff from participating in state marijuana research programs and allowing them to discuss medical marijuana treatment with patients, and this policy must be reversed. Financial institutions' banking guidance on territory businesses. Although guidance for that came for those financial institutions in 2014, it was certainly welcomed, but it was not extended to secondary and tertiary businesses, those who rent space to medical marijuana businesses, for instance, causing an unnecessary chilling effect on the industry. We need to remove the outdated and impractical federal prohibition on marijuana. The majority of the House of Representatives have support and passed amendments on appropriation bills to prevent the DEA from interfering in state medical marijuana laws. We've introduced a flood of bipartisan, bicameral legislation to address issues around marijuana, and the Cannabis Caucus will help force those floodgates open. Unfortunately, the administration has been flip-flopping, giving out mixed signals on their stance on marijuana. With that in mind, the president, unfortunately, will have the final say about which direction his administration goes. And Rep. Polis and our office will do everything possible to hold him accountable on his word when it comes to protecting small businesses, the middle class, and the marijuana industry. I'm confident that we will soon see common sense approaches to the federal marijuana law passed here in the United States. Thanks for being here, and again, thanks for helping move this conversation forward about the nation's drug policy.
Representative Jonathan Singer.
All right, I'm going to set my timer here because the most dangerous thing to do in my line of work is to ask a politician if he has a few words to share. But I'm State Representative Jonathan Singer. For those of you who don't live in House District 11, welcome. Welcome. I'm the proud State House Representative for Niwot, Longmont, Lyons, and Allens Park, and you're right here in the sweet spot here at the Farmette. So thanks to Yellow Scene for hosting this. Now, I always like to share a little bit about my story. When we talk about regulation, I think regulations start with people. People coming together with shared values, with different values, trying to do the right thing, because another word for regulation is safeguard. You know, the Clean Air Act is a regulation. It's also a safeguard against the fact that people don't have the right to pollute the same air that all of us breathe and cause huge health effects for any of us. The Clean Water Act, seen as a regulation, is a safeguard to ensure that the water that we drink can't be polluted by somebody else with no responsibility to be had. So, yeah, we can clap for clean water. It's a good thing. I mean, I know we're here to talk about marijuana, but I'm pretty sure Colorado is pretty well known for another intoxicating substance that uses a lot of water. So, 2011, I'm a social worker. I'm working in a child protection unit in Boulder County, trying to keep families together and trying to keep kids out of the foster care system, but most importantly, keep them safe. And I get a phone call. And it's from somebody who says, you know, Jonathan, you should really think about running for office. I know that, I'm not going to run for office again, and you should think about it. And so I started to think about it in 2011, working in a child protection office. Had you told me that by 2012, I would be serving in the State House of Representatives, the second youngest person serving there at the time, that by the end of my second year, I would have passed a bill that would have put something on the ballot that successfully increased taxes in the state of Colorado in the first time in over a decade, I might have asked what you were smoking. Because working in a child protection office, doing that kind of work, I saw the effect of drugs and alcohol on families, and I have what you call sampling bias, right? Because I saw the worst of it. When parents can't stay sober long enough to drive their kids to school. When parents can't stay sober long enough to make it to teacher-parent conferences. Parents can't stay sober long enough to be alive to see their kids' graduation. That's the reality of drugs. But I also knew in 2012 that it was time that we start treating marijuana like the drug it is, but not the drug that people fear it to be. And that's the distinction. This isn't heroin, this isn't meth, it's not alcohol either. But it is a substance that can impair you, but it is also something that doesn't belong on our criminal drug schedule, higher than cocaine, putting people in jail, because if prohibition worked, it would have worked by now. So we could either set our money on fire and send people to jail, Or we could set people free and use those same dollars to take it out of the black market and set people's lives free by investing in the things that that tax did. Investing in our schools. Investing in criminal justice programs that don't put people in jail, but say, once you've gotten out of jail, we are going to give you a hand up. We're going to show you a way out of jail that you won't have to come back through here. We're going to make sure you get in touch with counselors, with housing, with the opportunities that you may have never been given the first time, but we're going to give you a first chance this time. And a budget, the thing that we pass in the state of Colorado, a budget, in my mind, is a moral document. It is a contract between you, the taxpayers, and us, the lawmakers, to say that out of the common values that we all hold, the belief that we all should enjoy the same freedoms, we should all live in relative safety, we should all be able to access our education and clean air, and make sure that our neighborhoods are the way they should be, stays that way. Yeah. And so when we passed our budget, when we took those marijuana dollars that you thankfully spent your money on, thank you very much, by the way, we invested it in exactly those things. In building better schools in rural Colorado where our walls and floors and ceilings are crumbling. We spent it on making sure that we could deal with our opioid crisis, to make sure that people who had no malicious intentions but were unfortunately told by the medical industry that what they were doing was safe, have a way out. Have a way to save their lives by getting in touch with counselors instead of parole officers. And the very people that were attacked by a drug war, the very people that were never given that first chance, now when they're released from prison and they're struggling with addiction, they're struggling with mental health issues, for the first time in Colorado's history, we are actually saying to those folks, and average folks of middle and low income, we are going to find ways for you to have a safe place to live that you can afford. Yeah. When you look for, when you look for reasons, when people look for reasons to do drugs, they don't have to look very far. We live in hard times. Family life is harder. Getting a leg up, being able to pay for college, being able to pay for gas has gotten a lot tougher. So when you give people an ounce of hope, you end up with a pound of cure. And that's what we've got. That's what we've got here in Colorado. Now I'm going to get off my soapbox for a minute here and talk a little bit about regulation, since that's, I guess, what you wanted to hear about. But, you know, like I said, I didn't expect to be there in 2012, and it all began with a bill about a marijuana DUI law that I actually supported. And I believe that we should have a marijuana DUI limit because, you know, if patients are being pulled over for any reason at any time and there's no limit, that means law enforcement could stop you for having 1 nanogram in your blood or 100 nanograms in your blood. It doesn't matter. Now, we know we got a long ways to go to make that law work, but when I voted for it, I surprised a lot of Republicans, and it was about 10, 11 o'clock at night when the bill finally passed the House, and they said, "Oh, Jonathan Singer, oh, thanks for your support. You should come out and have a drink with us." You're like, did we just pass a DUI law, guys? You couldn't have written this story any better, but I said, you know what, I want to go sit and talk with the opponents of this bill and understand their point of view. I think I should be accountable to them. And like I said, you couldn't have written this better. The opponents of this bill were also at a bar. The bar's name was Prohibition. And I explained my point of view, they explained their point of view, and, you know, I think that I may have changed my tune on that particular issue, but I said, you know, look, fundamentally, marijuana should be legal. I'm tired of having cartels take dollars that we could use to invest in people. So they said, well, actually, we're working on something about that. Why don't you take a look? So I took a look at it. 2 weeks later, I signed off on it. Turns out it was Amendment 64. We have 100 state lawmakers in the state of Colorado. 2 signed off on Amendment 64. 2% of the state legislature. Myself, a Boulder County progressive, and Sean Mitchell, a state senator who is a Tea Partier, and I mean that in the only the best senses here. And, you know, I tell people, you know, marijuana has finally brought at least 2 sides of the aisle together. Now, he was term limited. which meant that when I came back to the Capitol in 2013, when Amendment 64 passed, I was the only sitting legislator that had publicly endorsed that campaign to treat marijuana similar to alcohol. So now leadership looks at me and goes, well, you wanted this, could you go make it work? Sure, why not? So what did we do? Like a lot of you know, we created a seed-to-sale tracking system. We created both barriers to entry and doors to entry into this system that have its roots, in many ways, in our war on drugs. We created a system of taxation that ensures that these dollars don't go into some slush fund for everyone's pet project or pork barrel project at the state legislature, but actually go to our schools and go to the critical services that we have historically underfunded in a state where we have one of the highest addiction and highest suicide rates in the nation long before marijuana was ever legalized. But now we can have an honest conversation in an honest way to deal with that issue without taking money from other sources. We did a system that is imperfect because guess what? We were the first in the nation and arguably the first in the world. But I encourage you to take a look at what we've done because states around the country are now coming to Colorado. Nations around the country are coming to Colorado and they say, look, we see it happening in Washington, we see it happening in other states. You guys seem to have a better handle on it. You have a more robust industry. Yeah, no, you can give yourselves a pat on your back for this one. Why did it work? No, I'm asking. No, I think the reason it worked, and I'm going to give our governor a lot of credit here, is the day after Amendment 64 passed, he said, all right, it is now part of the Constitution. I opposed it, but my job is to enforce the will of the people. I want the opponents, the proponents to get together and figure this out. DAs, defense attorneys, legalization advocates, patients, soccer moms, psychologists. We want you all to get in the same room together and figure this out. And so they came back with about a phone book worth of recommendations, over 90% of which they all agreed on. So yeah, we fought over that 10%, but that phone book was largely filled with consensus ideas because it was time to pull up our big boy pants and do the right thing for the people of Colorado. And that's how it starts. It doesn't necessarily matter what regulations we put in place, and I tell other states this, it's how you do it. Is everybody invited to the table, and who are you leaving out? Those are the questions that we need to be asking ourselves every single day because it is imperfect. We still don't have a model of social use that works in the state of Colorado unless you believe that, well, I don't know, Red Rocks every weekend. Right. But or someone's front porch that shall remain anonymous until she speaks later on today. But those are the things that we still need to work on. Those are the challenges that we still face and the rest of the nation faces. The fact that, we said regulate like alcohol, but we're still here today, 2017, 5 years later, and we don't have something that's the equivalent of bars when we have something that is the equivalent of liquor stores, it shows you how far behind the curve we really are. And I don't know if the cameras are picking up the sirens. I'm sure it's not for me. But that is the shadow that remains over us at the state capitol. The fear of federal intervention. With the stroke of Jeff Sessions' pen, they could repeal the federal memos that were put out, not laws, but memos put out by the Obama administration to say, you know what? We're not going to regulate this, allow states to regulate this. We're going to go back to that Schedule I thing that we've been doing for years and reignite a failed war on drugs. Elections have consequences, folks. Who we vote for, Democrat, Republican, Libertarian, Vegetarian, I don't care. It's about where people stand. And when a presidential candidate refuses to speak unequivocally and then picks an attorney general that says marijuana isn't something that good people use, I see a room full of good people in front of me today.
Right.
So I'm going to close on just one additional story, and then really, most importantly, I look forward to your questions after the other speakers have gone. But today is a bit of an auspicious day in many ways. 2 years ago, more than that now, a woman from Jefferson County came to my office. Her son was using medical marijuana legitimately. He's quadriplegic on a trach tube, can't speak with his own mouth, but by looking at him, his eyes spoke greater volumes than, well, any words that I could share with you. And she said, you know, my son has this little postage stamp size marijuana patch on his wrist. He got kicked out of school the other day, even though he has a 24-hour nurse, because they said that marijuana is a federally illegal drug. And so we got back, we changed the law, it didn't work. So we changed the law a second time last year. And we said that in every single public school, fighting 178 school districts that disagreed with us, that your right to your education and your right to your medication are one and the same in the state of Colorado. And so you figure out a way, school districts, to make sure that these kids who have 2 doctors' recommendations, sometimes even a full-time personal caregiver, get access to their medication so they can enjoy school just like every other kid.
Yeah, right on.
That law lives on in perpetuity under the name Jack's Law, because Jack Split, the young 14, 15-year-old kid whose mom and himself came to me, was able to not only charm the ties and pants off of myself, but almost every single member of the General Assembly. And I give so much credit when I talk about coming to the table. I give so much credit to the moms whose kids are struggling with debilitating seizures and cancer and now post-traumatic stress. And speaking their mind, speaking truth to power like all of you can do at the state capitol, because that's how we do business. And going in front of a Republican Education Committee, getting a unanimous vote and unanimous standing applause from those senators, Democratic and Republican, in a building where we don't allow clapping because it's really pretty a sad place. But that is the power of what you have. That is your ability to tell your stories, to show up clear-eyed and sober-faced and say, I use marijuana and I'm ready to speak my mind, because it's time to treat marijuana like the drug it is and not the drug that some people fear it to be. And we can improve the lives of individuals and improve the state of Colorado for the better. Thank you, guys.
He made me think of a story about my cat. So I inherited my parents' 20-year-old cats when my parents passed. And I promised my dad I would take care of the cats. And now they're 20-something years old. And one of the cats has developed a hyperthyroid. And so I've been treating her with some CBD as well as the thyroid medicine. And the CBD, this cat's very anxious all the time. And the CBD has helped her relax and be able to enjoy the environment without being so stressed all the time. So, from animals to people. All right, I would like to introduce Richard Collins, who is a CU professor and teaches a course on marijuana law. So he's the guy to ask about all those questions.
Thank you, and thanks to Yellowstein for a great arrangement. What a good dinner. What a good bar. Yes, I teach a course in marijuana law, which is a course on the campus of the University of Colorado, which is still ground zero for the drug wars. I mean, it's not legal. The medical people, they tolerate, but it's not legal on the campus. So, of course, my course cannot have a lab. It's too bad. Anyway, so the reason I'm up here is to talk about what the legislature did last term with regard to home grows. Our laws create a dual system for access to marijuana. On the one hand, we have the commercial system, where we have seed-to-sale tracking and licensing and taxes and tests for purity and pesticides and safety tests and zoning laws to say you can't do it at home, you have to do it in a commercial zone. On the other hand, both of the constitutional amendments create a personal right to grow marijuana at home and to process it at home. Now, it doesn't have to be, but mostly that's where it's done. Now, the basic rules in those amendments is 6 plants. I think that's a pretty silly standard, but it's embedded in our Constitution, so what are we going to do? But in any case, 6 plants gets multiplied. So suppose that we have people with a right to grow who are rooming together. So the roommates, you multiply 6 times the number of roommates. Or suppose we have a caregiver who has a legal right to serve five patients. So multiply by 5. And in addition, the medical amendment says that a doctor can say that a patient needs more than 6 plants. So for all kinds of reasons, you can have a home grow that is a lot bigger than 6 plants. And of course, at the home grow, no license, no tracking, no testing, no zoning. There are safety rules, but they're really not very well enforced. And so the state thinks this is bad. Now I'm going to read you from the preamble to the statute that the state passed, which, I mean, Jonathan knows this well, I'm sure. But in any case, so the state, this is the preamble to the statute. The extended plant count and primary caregiver provisions have created a situation in which individuals are cultivating large quantities of marijuana in residential homes. These create a public safety issue and are a public nuisance. A site in a residential property can overburden the electrical system. It can create a fire hazard. It can put first responders at risk. It can cause water damage and mold in the residential property. It can produce a noxious smell. That's, of course, a matter of taste. That limits the ability of others who live in the area to enjoy the quiet of their homes. Often the site is a rental home, and the renters cause significant damage to the home by retrofitting it to be used as a large cultivation site. When residential property is used, it often lowers the value of the property. Of course, well, that's a terrible thing to do. And finally, a site in a residential property can serve as a target for criminal activity, creating a public safety hazard. These large-scale multinational crime organizations have exploited Colorado laws, rented multiple residential properties for large cultivation sites, and caused an influx of human trafficking and large amounts of weapons, as well as potential for violent crimes, blah, blah, blah. In other words, the state really thinks these home grows are bad. And there may even be home grows that fit that definition. The problem is there are lots of others that don't. And unfortunately, the state's remedies, insofar as there's a difference, are dead backwards for reasons I'll explain in just a minute. So the legislature passed Bill 1220, which limits home grows to 12 plants total. So if you have a caregiver with a right to grow 12. If you have roommates who have a right to grow many more than 6, 12 is the cap, blah, blah, blah. It's an absolute cap for any given residential property. It does have a special sub-provision that says if a local government says okay, it's 24 instead of 12. The other thing that the bill does is it gives greater authority to local governments to regulate home grows in a very vague way, but it seems to basically say local governments can do anything they want. And there's a companion bill, 1221, which offers money to local governments to help them regulate home grows. Well, okay, so the 12 plant limit is, of course, challenged in a lawsuit because there's a fair argument that it violates these constitutional provisions. I have no idea how that will come out. I can figure out various I mean, the courts have been fairly unreceptive to expansive arguments about the constitutional amendments. So I wouldn't count on these lawsuits winning, but at the same time, they have some power. That's not what I'm here to talk about. And then, of course, as you've already heard from other people, we have the side issue is what is Mr. Sessions going to do? What is Mr. Trump going to do? I mean, Mr. Sessions is back in the room where they made reefer madness. He still believes it, every word of it. I'd hoped when he got out of Alabama he might get a little more imaginative about life. It's the other way. He took Alabama with him to Washington.
You can have the South, but you can't take the South out of the... Oh, yeah.
Anyway, so here's my critique of these laws. I have two things to say about this. I think the 12-plant limit is nuts. Here's why. The 12-plant limit says nothing about the size of the plant. It says nothing about the THC potency of the plant. So the 12-plant limit for those who can afford the best is no limit at all. You know, they will get 12 bigger plants and 12 more powerful plants, more potent plants. In other words, the allegedly illegal operators who are cleaning up with money doing this will have no trouble buying the big plants, no trouble buying the powerful plants. So who's going to be hurt by the limit? The little guys, the people who are legitimate medical users at home. So it's dead backwards, that standard. I mean, I understand the state's concern, but if they want to come at it, that is just dead backwards. And they were told that, and they passed it anyway. The other thing the new law does is empower local governments to regulate more and even give them some money. And that part, I think, is a good result, because if you're going to tackle this problem, if home grows really are a way of diversion into the illegal market, then local officials are a lot more likely to be able to deal with it sensibly than somebody straight out of the state government. So in other words, it's a local problem, and so trying to get the local governments to deal with it and giving them money to help them to deal with it, I think is definitely a better approach.
Who gives them the money?
What's that?
The money? The state.
Oh, the state would give the money. Yeah, the money comes from these marijuana taxes that we've just heard about, which the first $40 million a year does go to help schools in poor parts of the state, and that's terrific, because that was a terrible need. And it still is. This isn't enough, but that was a great part of it. It's anyway. But at some point, the legislature does have complete discretion how to spend the money, and this 1221 says let's spend some of it to deal with this local home grow issue. We have a question thing later, and I think I better postpone that. But I'll be back up here with all these other guys. And so.
Thank you, Richard Collins. Yeah, we're going to do a Q&A at the end. Last year, we had Q&A after each speaker, and we ended up accidentally going over by like an hour and a half. So we decided to reformat it this year so we could keep it on track. Next up, Teri Robnett, who is part of the Cannabis Patients Alliance and a huge advocate for cannabis patients' rights. Thank you.
Hi, everybody. Can you hear me okay? My name is Teri Robnett. I am the founder and executive director of Cannabis Patients Alliance. I'm a medical marijuana patient advocate and policy advisor. So I get to work with awesome people like Representative Singer and Congressman Polis on issues and policies around cannabis. So first, though, I'd just like to take a second and say thank you to Yellow Scene for doing this tonight. Thank you for including me, and a great dinner. I have never been here before. This is a fabulous place, and I'll be looking forward to opportunities to revisit, because I really like the chickens and the alpacas. And let me give you a little background on who I am and kind of what I do, sort of like Representative Singer did, so you know why I'm even up here talking to you. I was diagnosed with fibromyalgia 30 years ago. It'll be 30 years next month. And I have tried all kinds of therapies and things dealing with chronic pain and the chronic fatigue and the anxiety and the digestive upsets and the insomnia and all the things that come with that. And when I discovered cannabis in 2009, medicinally, it really changed my life. And so now I have pushed away all of the pharmaceuticals and I use cannabis exclusively for the most part. I take an ibuprofen every once in a while and, for muscle soreness, but primarily I have been able to use cannabis to take care of all of the symptoms from fibromyalgia, the pain, the fatigue, the insomnia, by varying the way that I consume and the strains that I use. And one thing that's really awesome is that with all the drugs that I had been prescribed over 20 years, I could have had some really serious drug interactions. With cannabis, I never have to worry about that because it's all one drug. So I started my journey in the cannabis world in 2009. Now, I'm a Colorado native, and so I've always been around weed. I graduated in the 70s. There's always been great marijuana in Colorado, at least as far as I've known. But I never really got into the scene, and I never really thought about who grew it or where it came from or anything else. I would go to parties, and people would be drinking, and pretty soon a joint would come out or a pipe or whatever. And that's about what my experience was. We also had a pedicab company, and if you want to know where to get weed, you ask a pedicab driver. So we always, every once in a while, someone would pay their rent and leave a joint in the envelope. But in 2009, someone moved into our building and opened up a dispensary. And I started working for them as their communications director. And it was like being dropped into a language immersion program in a foreign country. I didn't know indica from sativa. I had never seen a vaporizer. I didn't know one strain from another except for maybe a handful. I'd heard of Acapulco Gold and Maui Wowie and a few of the others that were old favorites. But I didn't really know anything about this. So that's where I started. So I understand when I'm talking to people, when they say they feel like marijuana just got dumped on Colorado on January 1st, 2014. I understand that feeling. And what it is it's really just a lack of awareness. We all know weed's been here all along. It's just now it's in the forefront. And a lot of people are really struggling with that. I didn't get started in working on policy until 2012, working on that same DUI bill that Representative Singer had talked about. And we killed it in 2012, and then they came back with a variation in 2013. And after 3 tries in that session, they finally managed to pass it. And that's where we have our 5 nanograms. When I was in the dispensary in 2009, it was back in the first green rush when we had people that, came in all the time for doctor's appointments. We had doctor days, and we had a dispensary, and we had a music room and a game room, and people would come and they would socialize, and it was different then. And I got to talk to patients one-on-one, and I will never forget one patient. Well, a lot of them, but one in particular, this big young guy, big Marine that came into my office and sat down and was talking to me. And I watched him turn into essentially a pool of emotional goo as he begged me to find a doctor that would help him use cannabis to break his heroin addiction that he had developed while he was in the military. It was so sad. And I've never forgotten him. Now, my background, I've dealt with sexual assault victims. I was a paraprofessional counselor for rape crisis, on a rape crisis team. I've dealt with a lot of these, but this one really got to me, and I'll never forget it. So in 2012, when I heard about a petition that was being presented to the Board of Health to get PTSD added as a qualifying condition, I was there. But I didn't realize then that was the 3rd time we had petitioned the Board of Health. There was a petition for PTSD back in 2007, and it failed. It got just tossed aside. There was another one in 2010 with some of the people that I worked with in the dispensary. Again, tossed aside by the Board of Health. Because see, what happened is Amendment 20 set up a specific path for us to add conditions. There were only 8 in the original Amendment 20 that was passed in 2000. Only 8. But it said you can petition the Board of Health. You can petition the governor's authority to add more conditions. So we did, over and over and over and over again. 2007, 2010, 2012, and 2015. And we were turned down over and over and over. Why? Because the Board of Health was judge, jury, and executioner. They were charged with reviewing. They were also the ones that decided what the criteria was for anything passing. And then they made the final decision. All of that, well, some of that changed in 2014 when we passed a bill, Senate Bill 255, that took money from an inflated bill or an inflated account of patient fees that they had paid. They'd been overcharged all these years, the cost for getting their license, and had built up in this big slush fund. Millions of dollars. And the legislature had been put on notice that they needed to do something with that money. So we kind of came up with this little scheme that if we could take some of that money and put it towards something that would benefit patients, like research, that might be a good thing. So we took $10 million and we put it toward research, not research like NIDA has done all these years into, oh my God, how horrible marijuana is. It was specific. It had to be on the benefits and efficacy of medical marijuana. And the organization, the group that was overseeing that process, the Scientific Advisory Council, had to have a patient representative on that council because it was patient money. And guess what? I have the honor of fulfilling that role on the Scientific Advisory Council. So we funded 9 studies. 2 of them were on PTSD. One of them was Dr. Sue Sicily's study down in Arizona. She had been, after she got everything in order, the University of Arizona decided that it was just too controversial, and they shoved her aside and pulled her funding. So we were really excited to give $3 million to Dr. Sue Sicily and to fund that study. But one of the really great things, too, is that we funded both clinical trials and observational studies. Clinical trials are the ones that you have to go through NIDA, and you have to get all the approval from the DEA and everybody else if you want to use cannabis, because you can't just grow the cannabis and use it yourself. You can't go down to the dispensary and give it to your patients. You have to get it from the national farm, marijuana farm in Mississippi. That's the only place you can get it to do research. So one of those trials, one of those studies is a clinical trial. The other one is an observational study. What that did is it opened the door for the Board of Health to have to consider both clinical trials and observational studies when it came to evaluating these petitions. Before, we found out that they were holding us to a standard where only clinical trials were being considered in evaluating whether cannabis was good for any of these conditions we were petitioning for. Let me tell you, there aren't any. There aren't any clinical trials on a lot of these conditions because our government won't let us do the work. They won't let us do the research. So our hands were tied. There was no way until now that we could ever get past that threshold. We could never. They set an impossible bar for every petition that had come before. The other great thing is that in January 2015, someone filed a petition for PTSD, and it was reviewed by the Scientific Advisory Council. That had never been done before either. Before, it was 1, 2, maybe 3 doctors or clinicians would look at these petitions and go, I don't think so, and toss them aside. But this was a whole group of experts that the state had already set up for all these studies. I mean, if we are good enough to give money for these studies, surely we're good enough to evaluate these. We did. And after a very long debate, we passed this petition onto the Board of Health with a favorable recommendation, including Dr. Larry Wolk, the head of the CDPHE, who had opposed us in the past. So that conversation evolved. We have evolved this conversation by going at it over and over and over again, never giving up. Unfortunately, bad news, we did go before the Board of Health. We brought 50 people before the Board of Health testifying, begging, not just veterans, but women, children, supporters, psychiatrists, psychologists, begging for this, and still they turned us down. They still said no. We filed a lawsuit, and that lawsuit was pending going into the 2017 session. But I will tell you that thanks to the great work of people like Representative Jonathan Singer and Senator Irene Aguilar, who sponsored Senate Bill 17017 that was introduced on the first day of the legislative session in 2017, thanks to their hard work and dedication, not just this session, but year after year, standing up for us, here listening to us, being willing to be open and listening to the conversation. Thanks to them and everyone else that stepped up to help with this effort, we finally passed a bill that allows medical marijuana for PTSD. Now, the reason I want to tell you about this is never, ever give up hope. Never. We fought for this for 17 years. It took 17 years to finally get the first condition added to the list of the original 8. 17 years. It took 4 petitions to the to the Board of Health. It took 2 trips to the legislature, because we did it again back in 2014 and then now again in 2017. It took a lawsuit. It took hours and hours and hours of conversation. Because, we want to believe the story about a bill's just a bill. Yes, it's only a bill, and how easy it is to get passed. And you just introduce it. It just comes out of nowhere. It gets introduced and people vote on it and then it becomes a law. It's not that easy. But it's worth it. Because I learned something really, really important. I got this really great piece of advice from that man over there a few years back. And I cling to this, which is, you can't do this work if you don't believe in incremental change. You have to believe in incremental change. You have to continue looking for the path forward. Every time we were defeated, we regrouped and we continued to look for a path forward. We continued to talk to Representative Singer, to talk to Senator Aguilar, to talk to Senator Holbert, to talk to all of these people, the governor's office, everyone, to get them on our side. Because let me tell you, one person can make a difference, but one person can't do it alone. We all need to work together. And it was by building momentum and building coalition over the years that we finally were able to get this done. And I shared this story with my friend Lisa Reville, who is with the Harm Reduction Action Center, because she's been wanting to get a safe injection site in Denver for quite a while now. And guess what? We're having that conversation and we're closer, and I'm really hoping that that's going to happen here really soon. So I told her, don't give up. Don't give up. So whatever it is, whether it's PTSD, whether it's cannabis, whether it's environmental rights, whether it's women's rights, whatever your issue is, keep fighting. Keep looking for that path forward. Keep believing in that incremental change. Keep believing that that one person can make a difference, but build your coalition and get out there. And I'll tell you, there are people out there willing to work and willing to listen in places of power. You just need to have the conversation. And I encourage you to please go out and do it. Thank you.
That was very strong. One of the things I've learned over the years is that harm reduction has far greater results with addiction than some of the other methods that are currently being employed, and cannabis could be a real transition in that area. We're going to open up to the Q&A. This is the real conversation. This is what the whole point of this event is, to have a conversation for us as a community. And so we're going to open it up. Like I said, last year we went on a little bit too long, so I think this format helps us. I hope everybody has their questions in mind, and this is an open dialogue. The speakers are going to come up, and we're going to raise our hands, and I guess I'm supposed to pick who gets to ask their question first. I don't know. We haven't really figured that part out. So we're going to have the conversation now about what we discussed and other topics that come to mind.
My name is Richard Madison, and it was a very interesting topic that you brought up, and I'm curious about the role that pharmaceutical companies may have had in delaying the ability to bring cannabis as a medical for anything. I mean, how long did it? Because it's easy to grow. I made aspirin in a lab when I was a freshman in college, out of tea leaves. It's not an easy thing to do. It's an easy thing to grow my own cannabis. Did pharmaceutical companies have a role in making this a difficult path?
No, that's a really important question you asked, and so I'm going to try and answer it as best I can and say that the pharmaceutical industry was not ready to fight this in Colorado, but it is something we saw in Arizona. We saw the pharmaceutical industry spending a lot of money to fight their legalization campaign. They were successful in Arizona, and part of the way they were successful was actually lying about where the marijuana tax dollars went. They said, oh, it never went to education, it never went to all these things, and which is just not true. What I would say is more important, and I qualified it by what I said at the very beginning here, is that, I have sampling bias, right? So what was particularly tough about the PTSD fight and really adding any other medical condition in Colorado is that the not pharmaceuticals, but doctors themselves, medical doctors, a lot of them are very wary of anything that isn't FDA approved for both good and bad reasons. Some of them may be in the pocket of pharmaceutical companies, but others are addiction psychiatrists. Others have seen the worst of the worst, and so they assume that all of this looks like the worst of the worst. And so we had to craft a very careful compromise with physicians. The pharmaceutical industry did not play in this debate in Colorado, but psychiatrists and Children's Hospital really did. And so we made some compromises that I thought were actually really good first steps to being able to look at, well, what will happen the next time we need to add another condition. So, for example, we said not only do you have to have 2 doctors' recommendations, but your diagnosis needs to come from a licensed mental health professional, which actually sounds like a good thing to me. Why should a podiatrist be diagnosing someone with a psychological issue, or a urologist? Doesn't make any sense to me. That's more bells and whistles than what it would take for someone to get Xanax or any sort of psychotropic medication, but maybe it's a good example for what we should do for Xanax. So it's not probably the best answer to you. What I would say on the federal level, and something that I'd be very careful about, is if we reschedule as opposed to deschedule marijuana, all of a sudden it does become a prescription drug, and it sets off a whole other litany of requirements and tests and federal hoops to jump through that could potentially completely upend the regulated medical and recreational marijuana industry as it stands here in Colorado today. So, if I was a prohibitionist today, I would try and reclassify it as Schedule 2 right now. I'm not to give anyone any hints, but that's what I'd be very careful about.
I just want to say that just tell a little story. This past year, Pharma had introduced some bills in various state legislatures, not here in Colorado, but one in South Dakota, that would reschedule CBD to Schedule 4. And but Pharma wanted the restriction that only applied to pharmaceutical CBD, which is Epidiolex, essentially, which isn't even on the market yet. So I was recruited. I flew up to South Dakota, which has a very draconian possession by ingestion law. So for me as a medical patient, I was a felon as soon as I crossed state lines. But flew up there and testified to their state legislature about this issue and actually got that piece, that requirement that it only be pharmaceutical CBD pulled out. And it was the first, this is the difference between a state that's nearby, South Dakota and Colorado, that was the first tiny success that their patient advocates had ever had regarding marijuana in that state. So it was a really big deal, but yes, pharma is definitely in the mix and definitely watching this, especially as other states come online. They were a little late for us.
Yeah, thankfully.
The answer is really a mixed answer because there's evidence that some pharmaceutical companies are very much interested in getting positively involved in the production of marijuana. I think a much bigger problem than pharmaceutical companies is the prejudice of the scientific community against herbal medicines. Marijuana is not a refined medicine. You don't know what the dosage you're getting is and so forth and so on. And a lot of scientists and doctors just go berserk over that particular fact.
Yep, they do.
Now, I would echo everything that my predecessors have said. Luckily, I also can project, so I don't need a microphone. And I really want to stress what Representative Singer mentioned. Rescheduling marijuana will decimate the industry in Colorado. It would be terrible for the medical marijuana world, and we should be talking about descheduling, not rescheduling. And that is, we need to stress that. So,
Yes, deschedule.
I think you guys are going to keep it. What we're going to do is have them keep the microphone, and you guys are going to have to project. Cool. And so if you have a question, raise your hand, and you guys get to pick.
We can repeat the question.
Yeah. All right.
sir?
What does Hickenlooper think of marijuana now?
I'm gonna let go there.
Y'all look at you.
Well, to be fair about this, the question was, what does Hickenlooper think about marijuana right now? I've got him on speed dial, so we'll put him on speaker. And I mean, to be fair, I guess it's both technically and legally accurate that we haven't passed the peace pipe completely on this one. You know, what I will say is his position is evolving, and just like Teri said that. Reminded me of something I said about if you don't believe in incremental change, you can't get stuff done. Fundamentally, you still have to believe in revolutionary change too. And I think we have some chinks in that armor where Hickenlooper really bought into a lot of the prejudices, but when he met Jack Split, he couldn't turn away. And so we're not where we need to be. But we're 10 miles further down the road than we were a year ago and 2 years ago. The one thing I didn't mention is that today is actually the anniversary of Jack's passing. He was a very sick kid, and nothing was going to stop his eventual passing. But even as kids who were very sick have passed away, that the governor met, he's written personal condolence letters to each of them because their stories have affected him as a parent. And so, like I said, I wish we could, we are pushing them harder. I wish we didn't have to push them as hard as we do. Like I said, I'd love to have something similar to bars so people can safely consume outside their homes, especially when they're renters. Part of the reason that we've run up against problems is because the gubernatorial administration is very nervous about this. I haven't ever gotten an outright no, but I certainly haven't heard an enthusiastic yes either. And so we've had to do a lot of sort of political bat flips to get to a point where hopefully we'll have something on that this year.
I'm not going to speak for the governor.
I don't know of any significant opposition the government has done to anything that should be done. And you compare this with the governors of Massachusetts and Maine. They're their people voted for legalization, and these governors have fought it tooth and fang. LePage in Maine is just a crazy man, and Baker in Massachusetts is not a whole lot better. So on a comparative basis, Hickenlooper looks very good to me.
You're great on a curve.
Well, and one thing that I will do, and I want to echo Representative Singer, something that he had said earlier, which is one of the best things that the governor did, and he and I both preach this when we talk to people in other states, is doing that initial task force and forcing people to sit down at the table, and that we have continued that process with our rulemaking, with stakeholders groups, really trying to bring in all sides. And I think that though we don't always agree and we don't always come out with the best possible solution, and sometimes we have to step back and redo things and shift a little bit, that overall I think that has served us very well. So I do give the governor props for doing that initially, even though he didn't include a patient on it, which I objected to vehemently, and then continued to follow the task force, because if a patient wasn't on it, a patient was sure going to be there to speak up. But that I think was really critical, and so I give him a lot of credit for putting that together and setting that as kind of the way to get things done. And we've shown that that process is the most effective, that when we tend to go outside of that on this issue is when bills and policies and stuff tend to run into trouble.
I have a question, two questions actually. So with regards to veterans and PTSD and getting the medicine that they need, is that just Colorado based or is it US based? And second question is for the professor, do teachers see any of the benefit from the tax that we've taken from the state of Colorado to help with salaries? Do the teachers get some of the rewards in their salary?
Two parts.
So,
Okay.
all right, this is a memory test now to see if we got the two-part question correct here. So I'll work backwards. So have teachers' salaries increased as a result of the marijuana tax is the second question. The first one was about vets and how that applies. Is that a Colorado thing or is this a U.S. thing? So I'll take a stab at both of them very quickly and then hopefully be corrected if I'm wrong or you don't like the answer. So the first one with VAs. So there is guidance from the Veterans Administration that says that if you're a vet, you're working within a state where medical marijuana is legal and you are using medical marijuana as recommended by a physician within that regime, within those set of rules, then you are not going to be potentially, held responsible in ways that would lead you to being kicked out of the military or potentially losing your VA benefits. So that's part of the reason that we were able to pass this bill this year is you had vet after vet after vet who lined up and said, look, we're not breaking new ground in Colorado. They've done this in Arizona and other states, and the sky hasn't fallen, and lo and behold, vets don't have to lie in Colorado if they were allowed to have PTSD covered. It's very easy to lie and say, I have chronic pain. Who doesn't, right? I went to the legislature. I have chronic pain. So
Mental pain.
right? So, we were sort of asking vets to either A, lie, or B, suffer in silence. And both were pretty reprehensible. What I will say is that is a VA memo. It's not a law. So once again, different administration, this administration could turn that on its head. And so until the Cannabis Caucus gets enough votes, we're going to be in a world of, gray area here. The second question you asked about do teachers' salaries increase? The short answer is no. So Amendment 64 specifically said that the first $40 million of the excise tax would go to what's called the BEST program, Building Excellent Schools Today. And my favorite thing about this topic is that I always wanted marijuana to be unattractive to kids, and so now I get to use my terminology in marijuana taxation policy, which is somehow completely unattractive to kids every time that marijuana gets mentioned. So teachers' salaries haven't seen a bump, but like I said, we are literally seeing crumbling schools. And so regardless of whether or not teachers are getting paid more, they didn't have buildings to teach in the first place. The second thing is the way that school finance works, which is almost as exciting as marijuana taxation, is that we have 178 separate school districts. Teachers' salaries are not set at the state level. They are set by those individual school districts. Now, it is completely, why I hesitate about this is we have funded additional positions for school health professionals, school counselors, we know school nurses. We know in the state of Colorado, the average ratio of school kids to school counselors is about 500 to 1. So if you've got a kid who is struggling, good luck. And so we've spent somewhere between, and off the top of my head, about $8 to $16 million of the marijuana taxes just from this year alone, to make sure that we can make sure that those dollars are spent the most responsible way possible to deal with kids that are struggling that might potentially fall into that category of drug use or drug misuse or abuse.
Thank you.
I don't know if there's any.
I just wanted to, and then I'll pass it to you, but one quick thing is that some local governments have passed their own additional tax on cannabis, and they can use that for whatever. For example, Aurora is putting their tax toward homeless. Another area is doing it toward education grants for higher education. So if they did that, they could choose to put that toward their school program, their school district. That's up to those local governments. But the state funds, and they'll also, if they have cannabis retail sales in their jurisdiction, then they get a share back of the state tax. And again, they get to decide how they want to spend that money. So they can choose. You can go to your local government and tell them that you want it put toward, if they are doing that you'd like to see it put toward certain uses.
Jonathan is correct about the fact that the earmarked tax for schools is for construction only, and there's a perfectly good reason for that. One of the side effects of TABOR is to concentrate the differences between poor and rich places, because the state is starved, but local governments are not. So if a local government is in a wealthy place like Boulder, it's not in too much trouble. If it's in a poor place, it's in big trouble. And that has meant no construction money for schools in poor districts. The state formula for allocating money to schools is pretty good about equalizing operational money. It's terrible for equalizing construction money. So the marijuana thing was crucial to fill that gap and give that money to marijuana, to poor school districts for construction. Now that doesn't go directly to teacher salaries, but that's the reason. Now above the 40 million, the government has discretion on how to spend it. It can go to schools if the government wants to. That's just the choice. And he's 100% right about the VA.
Truly, our veterans are one of our most powerful voices on the Hill when we're talking about passing marijuana legislation. So there are quite a few different groups and organizations that are working hard for medical marijuana to pass at a federal level, so that way PTSD can be treated locally and the different programs. So truly, one of the only VA marijuana grants that have been given out on a federal level for research and development is to a VA program. Specifically for our veterans and dealing with PTSD. Sue Sisley got quite a bit of federal money, not as much as she should have, but it is definitely moving forward. It's something that I always encourage people to reach out to, that they are a powerful voice for skeptics on the Hill. It's no secret that many of the people against marijuana are Republicans, and Republicans fight hard for our military personnel. And so seeing them and really having the VA and veterans asking for it makes a huge difference. Other questions?
I guess I was going to make a statement to Pitt, ask a question about people with disabilities. I've been involved in internet marketing, web development. I've been working in California since 2010 on websites, being ADA accessible. Because we got people with disabilities, people that want access to this medicine, but they can't even access a website to see where the medicine is. And so I'm wondering if anything is being, done in terms of people with disabilities, money being brought there, and how ADA Colorado, it's different in every state. But I'm just curious if anything's being done for people with disabilities giving you that money.
So that's a really good question, so I'll repeat it. Question was, what is being done for people with disabilities, if anything, with the marijuana tax dollars? And part of the issue you talk about with accessibility is, a lot of things are online now, but good luck getting a screen reader for someone who's visually impaired to actually correctly read something in a way that will help that person who is visually impaired to actually fill out the correct forms in the correct places. And I'll give you an example of how this is a problem in Colorado and what we're doing to solve it, and hopefully bring it back around to your original question. So the one thing about marijuana that was a huge unintended consequence is the proliferation of marijuana puns at the state capitol. And so we have a joint technology committee. It has nothing to do with marijuana, but maybe now it will. So the Joint Technology Committee just visited the Division of Vocational Rehabilitation a few months ago. And one of the workers there who had applied for a job incorrectly applied for that job because guess what? He was visually impaired. He filled out the online form that was approved by the state, and his name was where the social security number should be, and his last name was where his address should be. It was, a mess. And fortunately, the division was smart enough to say, this is why we should hire you, because this needs to be fixed. And so one of the things that I'm going to take back is I will, as we're trying to force patients, and I won't parse words, force patients onto this online medical registry system, I am going to double check and make sure that those folks that do have that expertise through my position on the Joint Technology Committee are getting, ADA accessible forms. I mean, that's quite literally the least we can do. In terms of specific services, I can't think of any from marijuana. It has really largely been relegated to substance abuse counseling, school counselors, after-school programs, before-school programs. The way that I wrote the marijuana tax is it was vague enough to be able to give us some flexibility, but the idea is I didn't want this to go to everyone's pet project, not to call this a pet project, but what we did is we said that the dollar should go to costs related to the legalization of marijuana. So you can make an argument that the legalization of marijuana might increase teen use. We haven't seen that, but it might. So, we should spend money on after-school programs. We have historically underfunded those programs. We've historically underfunded schools. I'll get off my soapbox after I say this, but it's ludicrous that the most essential services that we are depending on is coming from a substance that is federally illegal. And we aren't asking average taxpayers for just to take a little extra hit to do the right thing for people that need it. I know it keeps
all of it tonight.
Yeah, I'll stop.
Sarah. Oh, did you have another comment?
Well, maybe.
Okay, Sarah.
Well, I should say something. I mean, I'm not sure your question dealt with this, but of course, you guys have all read about the fact that one of the compromises in Amendment 64 was that employers could continue to have drug-free rules and enforce them, and you can need marijuana for your medical health, and you can still be fired, and the state Supreme Court has upheld that. That has to be an education thing. We have to persuade people that that's wrong. But there is one other amusing thing. You'll enjoy this. The federal government still says that if you use marijuana, you can't work for us.
It's true.
What has that done for them? They have a terrible time hiring people for. The Army has had to relax this rule. Trying to get techies to work for the government. They've had a terrible time finding drug-free techies who never use marijuana.
I think you need marijuana if you're going to work for the government.
Are you all tested? Being tested for marijuana use?
The legislators?
State legislature? I think it's pretty well assumed that we all must be on something to run. So the answer is no. So we're not testing.
And in the working for a member of Congress, it's up to the member of Congress whether or not that they want to drug test. And shocking, Congressman Polis does not drug test.
Before you get started, Sarah, I just want to say something else really quickly, which is that we've talked a lot about PTSD and veterans, but the reality is that our combat veterans with PTSD only are about 13% of people who have been diagnosed with PTSD. Veterans, combat veterans, 13%. But yet we owe them such a big debt of gratitude, not just because of their service, but they were willing to pick up this flag and carry it, not just for themselves, for everyone, because I'll tell you the real winners when that bill passed are women. Women of victims of domestic violence, of sexual assault. Women are diagnosed with PTSD at rates more than 2 to 1 of men. So the real winners with that bill, and thank you again, is women. So, Sarah.
Hi guys, thank you, all of you. Thank you, Yellow Scene. My name's Sarah Burke. I'm one of the physicians at Holos Health. And I wanted to ask you about the DUI bill. We in my office write far too many letters to probation officers and they're primary individuals who are in their 20s, either in Longmont or Boulder, who have been arrested for presumably DUI. They are testing negative for alcohol. They get taken to either a clinic or a hospital, are then tested, come back, not unexpectedly, at levels greater than 5, it's nanograms, is that right?
Nanograms.
Per deciliter, I think, maybe? Milliliter. For many of them, their 20s are ruined. They are paying a minimum of $10,000. I think most people appreciate that 5 nanograms is not a realistic level. And my question is twofold. How did the legislature arrive at 5 nanograms? And how can we modify that to reflect some realistic value? Anyway, thanks for taking my question.
You want to answer this first? Go for it.
I'll give it a shot. So I'll try and paraphrase the question for those of you who might not have heard it. This question was about the marijuana DUI law that is set up. It creates a 5 nanogram of delta-9 THC per milliliter of whole blood, where also chemists as well as tax accountants now at the Capitol. So for those of you who don't know what the law is today, we'll have a DUI checkpoint set up for you. No. So for those of you who don't know what the law is right now, there's a difference between the alcohol DUI law and the marijuana DUI law. So if one of us is driving down the road, gets pulled over, on suspicion of weaving or some sort of dangerous driving, you get pulled over and you blow a .08. That is a per se limit. And now, not being a lawyer, maybe I can hand this off to our law professor, but basically what this means is there's not much you can rebut at court. You can't.
Alcohol.
Right, for alcohol. So there's not much you can rebut. What this means is basically, and this actually happened, you can fight that, say the test was inaccurate, but you can't say I drive fine at .08. The 5 nanogram limit actually creates something called a rebuttable presumption, which means that we have put the onus now on the defendant, if they get pulled over, to say, Your Honor, members of the jury, this is a medical marijuana patient, and their doctor has signed this affidavit that says that they would be completely unimpaired at 5 nanograms, and the blood test said 5 nanograms. We actually, so what is happening, and the DAs are quite upset about this, is that people are actually being acquitted. Which is a good thing. That means the system works. I will say, even though I voted for the DUI bill the first time and the second time and the third time, the fourth time I voted against it and then it passed. So I should have kept voting for it. We did pass a bill this year that is getting us one step closer to addressing your second question. What do we do about this? Because why did we choose 5 nanograms? The science is the jury is out, to continue with the sort of the metaphor here. And so we took the best guess we could, which is a bad answer, and put a number to it and said, well, we're not going to create a per se limit. We're going to have this rebuttable presumption. So I did pass a bill this year, though, to say that state of Colorado law enforcement members, you need to start actually collecting data on who it is that gets arrested for what kind of DUI. We don't have a good source of this. Recreational marijuana passed in 2012, medical marijuana passed in 2000. We still don't know this because we know that drug interactions can affect these things too. And so law enforcement supported this, patients supported this, that we're actually going to start categorizing these things so we know exactly what is creating the problems on the road. And then I think we can take another step and say, you know what, look, there's a bunch of people that are testing at 5 nanograms that, aren't impaired.
But I think, and there is science to this, what is so egregious about this bill, it is not Delta 9, that it's active while those individuals, by and large, are driving. It could easily, at 5 nanograms, represent use, remote use, not acute intoxication.
We know that.
Yep, no, I agree.
Yep, we agree completely. I started working in the legislature as an advocate on the DUI issue. I was recruited by some friends to come in and testify against the 5 nanogram per se bill in 2012. And we managed to kill it twice that year. They tried to bring it back in the special session and we barely squeaked by, and otherwise we could have a per se limit. It was that close. A lot of people don't realize that. But a lot of those same arguments, things that you were saying, are the same arguments that we made. At the time, the prosecutors had around a 95% conviction rate under the old law, which was impairment, based on impairment. So we told them that chances are there were going to be people that were impaired at below 5 nanograms, newbies, people that had never consumed before, that wouldn't get caught, and that there would be patients like me above 5 nanograms that would get caught up in this. So with the permissive inference or the rebuttable presumption, it gave patients or chronic users the opportunity to mount a defense against this. And that's why you've seen reports in the media of people with 18, 20, et cetera, nanograms in their bloodstream that are getting off because they can show that they were not impaired. And it really is about impairment, and that was our argument to begin with. So now we found that what we have predicted, what we told them was going to happen, is what's happened. I've talked to prosecutors, et cetera, and they're complaining now that there are people below 5 nanograms that are getting off and whatever. Their solution, of course, is to lower it to like 3. They want it lower so they can catch all those other people and, the rest of us be damned. I want to put a little plug in, though. There is a research study going on Sunday from the Cannabis Clinicians of Colorado that is looking at impairment. And we're still looking for patients and recreational users to participate. So if you are interested in participating, it's called an Are You Impaired research, where we will take a baseline blood level and test we have DREs that are going to test you for impairment at your baseline, and then you're going to get as impaired, to smoke or consume until you think you're impaired, and then we'll do it again. So the great thing is you'll get a baseline blood level that you can then take into court. So if this is the kind of work and the kind of research that we need to continue doing so that we can answer these kinds of questions, please, Jonathan, stop by the research thing. It's going to be fun. It's actually set up to be kind of fun and entertaining. So anyway, talk to me after.
Just to add a couple points. first of all, as Sarah, right, well knows, one of the problems is that THC persists in the body much longer than alcohol does. So the alcohol test works fairly well as a scientific matter. The marijuana test does not. But I agree with these guys that the old test actually convicted more people. So as imperfect as this is, it's still somewhat of an improvement over the old test. And then further, the last point is just remind everybody that research on marijuana is strangled by the federal regulations, and this is just another area where the research is inadequate. And then of course, the opponents of Colorado constantly harp on this. Oh, people are driving, impaired. They're all high on marijuana, running around killing people in their cars. Mr. Sessions is big on this.
Oh, yeah. Can I ask one follow-up real quick? Like with alcohol, they tell us you can have a drink drink every hour to weigh so many pounds, this kind of stuff, and that's not scientific per se, but we have this information that we should stay with a certain amount of drinks. I have no idea what 5 nanograms would that equal one joint, would it equal 2 pots?
Why gotta go on Sunday?
Well, and that was always one of our arguments. It was sort of every time I would see Dan Pabon, one of our representatives, he would always ask me, what's your nanogram level? And I'd tell him, I have no idea. I have no idea. But by the way I consume as a chronic pain patient, I could pretty much guess that it's over 5 nanograms. So actually, I'm excited because this Sunday in this test is the first time I'm going to actually find out what is my nanogram level. I don't know because they're doing blood tests, blood draw. Blood test, just like they would if you were pulled over. So that's going to be exciting because I have no idea.
All right.
So I saw a patient who went through this process with his parole officer. We wrote him a letter. We get a call back about a month later. The parole officer, his THC level was 900 nanograms.
The parole officer?
No, the parolee.
Parole or probation?
The probation. The individual who is on parole. He was instructed by his parole officer he had to complete. At first, they wanted him only to get Marinol. Well, it turns out, I know, and we have one judge in Boulder County who will not permit an individual to use cannabis. She has mandated that he can only use Marinol. Wait. So what's happening is people are getting Marinol prescriptions. I shouldn't say this.
Yes, you should.
They may or may not be taking it, but they will test positive for THC. But judges apparently are still able to make this requirement. My point though was, to get up to 900 milligrams, this fellow was dabbing daily. So the amount of THC he was ingesting, unless you folks are in the industry, I'm guessing, I say that only because dabbing is probably most prevalent in the industry because of availability. I have a pretty good sampling vis-a-vis visits to my office. It's also less expensive for people in the industry, and it is more condoned. In the industry, people are allowed to go to work at various levels of impairment. Not my point, though. To get to that level of THC requires an activity like dabbing. As other points have been made, though, recreational use, medicinal use, by and large, does not include that concentration. All of those people will be testing over 5 nanograms, especially medical patients.
It's not a question.
Well, since it's not a question, I'll answer it. So yes, there are going to be lots of people that are going to be testing over 5 nanograms. For people on probation, we passed a law. Representative Joe Salazar, who's now running to be State Attorney General, worked to pass a law that says if you are on probation and you are working with a physician, the judge is able to take that into consideration. Just like if you were intoxicated with opiates and you have a painkiller, a prescription painkiller, the judge is allowed to take that into consideration when they're saying you must maintain sobriety at all times. They can say sobriety at all times with the exception that you're allowed to use XYZ as recommended by this physician.
I have a quick question on the DWI law. Colorado has a DWAI law, which is at the cop's discretion. Where does cannabis fall into that? And then the second part of my question is, while there's opportunity to fight it in court, that's very, very expensive, and 90% of the people take the plea deal. So how do we maneuver that?
Yeah. Okay. Well, actually, I've been hogging the mic, so I'm going to hand it over.
My question.
The question first.
Well, the question was about the form of state law, and I'm going to rephrase it a little bit. I mean, the gist of the choice for making a state law is you can have a numerical level of drunk driving, 0.08, or you can say it's up to the officer to decide whether you're a drunk driver. And the problem with leaving it up to the officer is, of course, you get a random response. Some officers are very different from others, to say the least. And that's one of the reasons we created standards like 0.08 and 0.10 and stuff like that. Now, that's one of the reasons why we tried to create a standard for marijuana as well, as 0.05. The problem is that there's not nearly the science behind the 0.05 as there is behind the alcohol standard, and there are a whole bunch of problems with it. But again, if the alternative is just leaving it up to each officer, you're going to get random law. I mean, just what does Officer X think? What does Officer Y think? I mean, it's got to be all over the place.
I don't think I can repeat the question, but it was about DUI and DWAI and how those about alcohol relate to cannabis. There isn't a DWAI for cannabis. DUI, but what's important to remember is that we already have a lot of bias and misinformation about cannabis going into the police reports as it is now. When you hear about anything that is marijuana related, be suspicious of that, because essentially anything that is put in the police report, like there was a pipe, or they had just come from the dispensary, even though it's all locked up, or that I smelled marijuana in the car, or whatever, if that gets written into the police report, that incident becomes marijuana related, whether marijuana had anything to do with the accident or the incident or anything. So a lot of times when you see these reports that are marijuana related statistics, especially from like HIDA, be really suspicious of those, because they are so subjective. They never go back and evaluate whether cannabis was a factor in the accident. If, for example, I was always worried that if I was driving up I-25 as a patient and somebody else hit me, that accident, even though I wasn't at fault or anything, that accident would go down as a marijuana-related traffic accident, even though marijuana had nothing to do with it. I wasn't the driver at fault, etc. So those are the kind of things that we need to be careful of, and putting more into the hands of the individual officers. It would be great for our officer friendlies, but that's not what we see, especially in a lot of these rural counties.
Also, urban areas too, where African Americans are.
Yeah,
they
that's true.
They have a little joint to end up killing them in the end. There was a guy 6 months ago.
Yeah. Well, and we've had a lot of issues we've had a lot of issues too with people that work in the industry, especially growers, trimmers, et cetera, getting stopped on their way home. They smell like weed because that's where they've been working, and immediately it starts this thing down the road. And yes, it is very, very expensive to defend because we've testified and been part of some of these cases.
I want to say something about something that Jonathan raised that hasn't been come up again, but it's the issue of public consumption. You know, legally we could not be consuming marijuana here. That would be a crime. Would in fact be a felony. But there's a comment here is that there's a two-level system here. So if you're wealthy enough, you fly into Colorado, the limousine picks you up and takes you to Summit County to the fancy restaurants, and on the way, of course, you smoke it in the car because that's okay. You're just a passenger, you're not a driver. So, in other words, if you're wealthy enough, public consumption is fine. The system works for you, but you're in the limousine. But if you're not wealthy enough, sorry, you can't do it.
By the way, the little limo cutout, we did that.
Question over here, and then we'll do it.
The little limo carve out in the language, we did that.
I'm a food scientist and I've been working a lot on edibles. And if people aren't aware, you know, edibles vary a lot in dosage, even with the current laws, okay? What I found out, and I guess I need some understanding of why this is in the law, I can't buy an edible as a consumer and send it to a laboratory for testing. So that's one issue, okay? The second issue is we have a big problem with testing, okay? We don't have validated testing laboratories, we don't have protocols, we don't have a lot of things. And I know it's still new, but we need some validation of laboratories, and we need the ability of consumers to be able to protect themselves. I mean, I had a gummy, you know, I buy a gummy product, first 3 gummies, nothing, take another gummy, I'm on the couch, you know, for a day. And this is a problem for the industry, because, and we all know it, okay, because it hurts everybody in this industry to have this lack of validation. So while I don't want to see pharmaceutical grade testing, we do have a testing problem and we do have a regulatory problem. So, 2 questions. Why can't I, as a consumer, send a product to a laboratory that I trust? And secondly, if I want to make a change to the law, what do I do?
Ooh, I get to answer that one. Repeat the question is, why can't I as a consumer send a product to a licensed lab to be tested? That's the first part. And second is, how do I change the law? First, I need to comment on a couple of statements that you made that I don't completely agree with. I think that the licensed labs in Colorado are actually overall doing a really phenomenal job. They are doing their best to provide accurate results. There are some that are hedging because their only customers are the industry. Because the MED and the state wants this closed loop system where nothing gets in and nothing gets out, that they only allow the licensed labs to test for the licensed industry. Now, we fought that as an organization. We have been fighting. We fought to get access to the licensed labs for patients and caregivers and home cultivators and people outside of the industry for a couple of years. And the reason that I'm sorry, I just kicked this over, but the reasoning was a couple of things. One is that the MED wants their closed loop system, like I said, and the CDPHE, their dilemma is, you know, if we allow these other people to come in and test and there's a contaminant, particularly something like salmonella or MRSA or something like that, what is our responsibility in dealing with that? And then the industry tends to think of the licensed labs as their own, that because they've jumped through all the hoops with security and money and everything else, that they have priority. My argument is you wouldn't have anything if it wasn't for patients, because everything we have is built on Amendment 20, which is there for patients. But so what the legislature came up with, or an alternative, is an unlicensed lab, which I have. I have a consulting lab. We do test for potency for people outside of the industry. We do a lot of hemp testing. We do a lot of R&D testing. So there is testing available. Now, one thing I can tell you from our own experience is that edibles are incredibly, incredibly hard to test. They are very hard to test. So when we counsel our patients and people that come to us, what we tell them to do is test the butter or the oil or something that you are infusing first, so that you can then calculate out your dosage from there. We are also the ones that because of the giant variability that now that products that are tested for the recreational industry have to be within 15% plus or minus of that potency that they are marketing. If they say it's 10 milligrams, or if they say it's 100 milligrams, it better be between 85 and 115. So we've done some of that, but understand, we have not been allowed to test cannabis until the last few years. Labs have not been allowed. It's been illegal to test marijuana in a lab. No university, even still not in Colorado, will test cannabis in their labs. So this has been a whole new development. And I think that a lot of the labs are actually doing pretty well. One of the holdbacks right now that we run into has been the Department of Health. The regulations say that we learned from rec, and for better or for worse. And by the time we got around to establishing testing requirements for medical, they added this extra little thing that requires the labs to go through proficiency testing. In the almost 3 years since that bill passed, the CDPHE has managed to get proficiency testing done for potency on flower only. That's it. That's not the lab's fault. That's not because of the labs. They all participated. The CDPHE was in over their head. They finally have realized it, and they are now establishing a reference lab. They didn't want to be involved in cannabis, and part of that is all the federal stuff and whatever. So they're now setting up a reference lab so that the licensed labs can then measure against or refer against them. So there is progress being made. I actually think that the majority of the labs that we have here in Colorado are doing a really, really good job for the circumstances that we're in. We've never done this before. And if you look and you read the stories, it's not just Colorado labs that are struggling. It's Washington, it's Oregon, it's Nevada. Nevada couldn't put product on the shelf because they didn't have labs to test it. We get calls regularly from other states that want to send us product to test for them because like Georgia, they can have cannabis that has up to 5% THC in it and high CBD, but they have no way of testing it. It's like me. How do I know what nanogram blood level I have? I don't know. They don't know whether the weed they have is 5 nanogram or is 5% THC or 15% because there's nobody to test it. So I think we're coming along. And but a lot of it is we are now pushing the CDPHE pretty hard to get their act together because that's been a lot of the holdup.
You want to answer part 2? How do I get involved?
How do you get involved in changing the law? Work with us. Because that's what we do. Talk to your state representative. I'll tell you that a lot of that momentum comes from them, and talk to the labs. There's a lot of these issues that the labs also see and would like to see some change, but it's an ongoing process. One other thing is the MED is getting ready to start their rulemaking process for the summer from the bills that were passed in the last legislative session. There's a couple on August 31st, and there's some others coming up in September. Those are open to the public. And I know that there's one on packaging and labeling. There's one on the new bill that allows for licensing for a research category. So go to those. They're open to the public, and you can make public comment on them, and you can write in comments so that you can have input on what some of those rules are.
Okay. Just a follow-up comment, because I'm a food scientist, okay? Food has been analyzed, and there's basic techniques for extracting things from food, pesticides, vitamins, okay? So the established techniques are out there.
Right.
Okay, and I understand that it's easy to test flour, it's easy to test extracts. You know, it's a simple extraction, you can shoot it into a GC or HPLC, but that doesn't absolve the state and the labs from saying, we need to validate. So I agree, licensed labs have jumped through huge hoops. I totally agree with that, okay? But just because they jump through hoops on licensing doesn't mean they're competent to take a gummy and extract the cannabis from it. And that's what I would love to help labs understand how to do this. I minored in analytical chemistry. I know this is not rocket science, okay? We're not designing, going to Saturn, okay? This is just ridiculous that we have laboratories who say, gee, I don't know how to extract cannabis from gummies.
Wait, no.
This is completely incorrect.
Can we just discuss, wait a minute, let's take this, all right.
I agree that Greg should
Yeah, I
respond to
agree
this.
with this lady.
I mean, there's some really good labs around here. You already said
I understand.
just throwing the labs under the bus is not right.
I'm not
No.
throwing the labs on.
Ladies and gentlemen, we're supposed to have questions from the audience, and it's very tempting for you guys to take the podium, but we need your questions.
She has a really good point, though, that we need testing standards in place so that even the average consumer can find out what they're getting in cannabis. Is it 10 milligrams? Is it spray-on GMO corn syrup? What are we getting in our food? We have a right to know as consumers, not just as the industry is out there, and we're not licensed, we're users. As users, we want to be able to test our products. I have asked that over and over. Who are the people on the street who can test my grow and what I am producing for sick people who need medical cannabis and don't want to inhale, but they want to inject?
The state regulations requiring labeling are very strict and very detailed. Now, maybe they're not always observed, but you read those. I mean, they're 50 pages of those regulations. They are very, very detailed, and they require very detailed labeling. In fact, one of the problems that the products have is that there's so many labels required, there's usually not enough room on the package.
That's right, yes.
It still comes down to the lab, so how can we get reputable labs?
Better labs.
And I do believe you can help address that question in the lab techs. Because as just a grower and a user, I want to test my stuff too, but I'm not a dispensary and I'm not a big, for-profit industry. I'm just a user.
I just want to jump in real quick. Last year, our event went on an hour and a half longer because everybody had so many questions, and it was so awesome. I loved it. And it's obviously a topic we're all invested in. You guys paid money to come to this farm-to-table dinner and talk about this. I belong in a political group as a hobby, and it's a debate group, and we have rules of civility, and you can't attack people, you can't name call, and there's all kinds of people in there, libertarians and right-wingers and Tea Partiers and Democrats and liberals and anarchists, and it's very difficult to sometimes, I'm a moderator, and sometimes it's very difficult to keep everybody from not getting mad. And this is a hot topic, obviously. It's a new thing for us. It's been against the law. People are serving sentences that they should not be serving because of cannabis. And so we are entering new territory. So I just want to remind everybody that I'm really happy everybody is engaged in the conversation, but our guests here are here on their own accord, and they are not representatives of the whole industry or all of the legal system. They are simply navigating it like the rest of us, and we are, as a group, responsible for helping make the changes that need to be made. So I just want to kind of remind everybody to, like, whew, have a glass of wine or take a breath or go smoke a joint, but not in public.
So, and I mean, the question, just to respond to the follow-up question, which is how do you get involved? I mean, that's why we're here. I mean, you can reach out to all of us. We're here. We're accessible. Email, phone. You can go to my website. It's got my cell phone number, singerforcolorado.com. Singerforcolorado.org got hijacked by a Korean real estate company. So renew your domain names, people. But we are accessible, and you know, to more specifically answer your question, there was a fundamental but incorrect fear that if we allowed people to test their product through licensed facilities, we would be contributing to illegal diversion, because someone could go sell on Craigslist and say, oh, I tested at this licensed lab and look, I'm perfect, and you know, I'm at 15% THC or 12% THC or 20% THC, whatever it is, and no contaminants. It's pretty ludicrous. I mean, I think the idea here is that we want to keep people safe, and we want consumers to feel like they can trust the product they're purchasing. And that is, I mean, fundamentally what it should be about. That's what we're fighting at the Capitol, and it's frustrating. And we hear that frustration, and that's why people like me and Teri and everybody here are doing our best. And the more you can help with this, show up to those rulemaking hearings. You know, if you don't know where they are and when they are, reach out to us. We'll give you the dates, the times, and the places. If you show up and you sound halfway reasonable, you might even have, you know, one of those government regulators come up to you and say, hey, I need to pick your brain on these 2 or 3 things. I need your expertise.
Also showing up and speaking in public comment about these and feedback could position you to be a participant on one of these rulemaking groups at a later time, because they do these every year. Every time they pass a new law, that affects the MED, the Marijuana Enforcement Division, they have to do rules about them. So every time, those are opportunities to be engaged and to participate. There are also committees and working groups and interim committees and things that meet, and they're all open to the public. There is like the retail marijuana Public Health Advisory Committee that reviews research, and they meet once a month or once every couple months, and they're through the CDPHE. The Scientific Advisory Council, the Marijuana Education Oversight Committee, all of these different groups, you can monitor. And you can put in your 2 cents. So look for these opportunities to get engaged. But the most, one that I can think of that is coming up the most quickly that would be of interest to you would be these rulemaking groups.
Yeah.
Just to switch up the topic real quick.
Can you speak up?
Industrial hemp. What are the laws currently? When will Colorado be able to overpower federal laws, prohibition, and so on and so forth? If that'll ever happen, but I'm talking about clothing or building materials.
You know, the fact that you love to start with on industrial hemp is that when it used to be legal in World War II, they were growing it, you know, for save the country. The leading state growing it was Kentucky, and you know the politics of Kentucky. They'd love to be growing it a big time again, but then they have these right-wing politicians. That's a problem. Now, the current law is that industrial hemp is defined legally under Colorado law as having a very low level of THC, and it's specified in the amendments. It's specified in the law. There are opportunities to study industrial hemp that are much easier than studying regular marijuana. A university can get a license to study industrial hemp very easily, and there are terrific industrial hemp grows, and then in turn, industrial hemp's being used to produce CBD, which is a non-psychedelic ingredient of marijuana that's considered to be one of the key reasons that it relieves pain. So there's a big firm in Boulder that extracts CBD from industrial hemp that's grown on a big farm somewhere in Ray, Colorado, and then markets the products, which are medical products but are not THC active.
So our office has done a lot of work on industrial hemp, specifically as it pertains to the federal level. In 2014, we were able to pass an amendment onto the Farm Bill, which allowed our universities to research industrial hemp. Colorado backed itself in a little bit of a corner with the 0.3% THC limit when it comes to industrial hemp, because there's a lot of debate as to whether or not industrial hemp and research and development should be at a higher level so that way more research can happen. Currently, there is a bill proposed in Congress called the Industrial Hemp Farming Act. The Senate companion bill will be coming out, and it defines industrial hemp outside of the CSA as 0.3%, which is huge and amazing, and we're actually going to have movement on it this year. We have a better than 50% chance of getting it passed because Representative Goodlatte, which is the chair of the Judiciary Committee, is on the bill. He's an original co-sponsor. We had to acquiesce to a few different issues with him, including a reporting, but we anticipate seeing industrial hemp legalized by the end of 2018, which is really exciting. Industrial hemp has so many wonderful uses and resources. It can make over 60,000 different products. The first American flags were made with industrial hemp. This is a product that we need to bring back that can revitalize our economy, that is great for rural Colorado, and we need to be investing in it and moving it forward.
We are the biggest importer of industrial hemp in the world, and the biggest source of it is China. No, you know what Mr. Trump thinks about that.
All right, well, we'll just leave it at that. I saw a question up here, and I'd rather get to questions.
Professor, you were speaking on public consumption, and I want your legal view and everyone else's opinion about how you interpreted social or public and open use, which is a part of the state constitution, Amendment 64, and how you see social use in terms of state legislature and local government as well.
Go for it.
64 gives no 64 expressly says public use is not legalized by 64. It doesn't. I mean, the medical amendment forbids public use straight out. The Constitution says medical use in public is illegal under the Constitution. The recreational amendment says it's up to the legislature and local governments. The only local government that's done anything is Denver has this Amendment 300 that's tried to legalize something, but it's kind of a mess. So it's still illegal is the gist of it.
Representative Singer, where do you see it going with the state?
So Amendment 64 said that open and public consumption was prohibited, which is, about as vague as anything else. Does that mean that open consumption is forbidden as well as public consumption, or do you have to both be openly and publicly consuming at the same time? Look, I'm already sounding like a lawyer, even though I don't have a law degree. And so what we've done is we've taken a few stabs at this over the last couple of years, and it has been remarkably challenging. And some of the opponents of this have nothing to do with marijuana, actually. So. If we wanted to allow, one of the problems is this issue of dual consumption, right? Can you smoke marijuana and drink alcohol at the same time? The Restaurant Association is just straight out opposed to that. Now, the restaurant, where is most liquor consumed? Not in college dorm rooms, but actually in restaurants. So the restaurant. Maybe not this weekend. The Restaurant Association is adamantly opposed to allowing this dual consumption. And some of their concerns are realistic, some of them aren't. They're concerned about people potentially over imbibing and then what liability they would have. So we've tried to work around that. So one suggestion that's been out there, and I hope that we'll see something like this year, and I've been working on this for a couple years now, is for liquor. Well, you know, it's just one more thing. But so with liquor, we have distilleries. And what do distilleries have now? Tasting rooms. We have wineries. What do they have? They have tasting rooms. We have breweries. What do they have? They have tasting rooms. They are not restaurants, right? By law, they are not restaurants. You can't prepare food there. And so why don't we do something similar where you could have a sampling room or something like that at a dispensary or at a grow operation or an infused product manufacturer where you could sample the product in a controlled environment similar to going to a restaurant where you have to be ID'd. I-300 is a little different in Denver, and so the state, you know, came out with some emergency rules about this. But I went back to the writers, the actual writers of Amendment 64. They said we never intended for public consumption to be banned in the sense that people would be consuming in a restaurant or a bar. What we meant is we didn't want people smoking up in parks and sidewalks and all these other things. So one way to get that out of the streets is to allow for a brick and mortar place to do something about this. So there is going to be hopefully another bill. There's been a lot of bipartisan bills. Some of them were actually a step backwards, in my opinion, last year, and so they died. But we're going to continue working on that.
Incremental change. Perseverance.
Are we with any other questions? Okay, whew, you guys were awesome. Really, thank you very much to all of our speakers, to all of our sponsors, to all of you guys who came out. This is the kind of conversations we need to be having. You know, there are ways to get involved and affect legislation, and these are the people that you can ask, and we actually can affect legislation, but as Teri said, you have to band together and get down there and start speaking and start activating. So, does anybody else have anything they want to say? I think this was a great event. I hope you guys did too. And we're going to be doing a third annual next year. It's going to be around product, including hemp, soaps. It's going to, we're just starting with our idea, but it's going to run the gamut. So it's going to be how cannabis can affect our lives and make things better. So, all right, thank you very much. And I hope you guys all enjoyed the meal. Thank you.